Hi friends, let's discuss about this CPT manual today. CPT, the expansion is Current Procedural Terminology, 4th edition. This actually occurred in 1966. So what we are having is a 4th edition of the manual which initially occurred in 1966. So this acts as a manual for medical nomenclature purpose, and it has various functions in the field of administrative, especially with reference to this healthcare sector and for medical care review. So we should also know that this acts as a uniform language and acts as a tool for communication between the physicians, the patients, and third-party payers. And moreover, with 2000, what happened was that the US Department of Health and Human Services has actually made CPT mandatory for electronic transactions. So whatever financial transactions that are going to take place between the covered entities, so CPT, the codes need to be followed. So what we are going to do today is we will go and see how this revision is done by this editorial panel. What we are going to discuss in this session is about this code classifications in the CPT manual, and which acts as a listing of descriptive terms and definitive codes that indicate this medical, the surgical procedures and services that are being provided by these healthcare providers and physicians. So let's start. It's we can comfortably divide this CPT manual into 3 sections as category 1 codes, category 2 codes, and category 3 codes. So the category 1 codes actually start from all these organ systems. It's being classified basically with these organ systems. Most of the classification is with organ systems. So the first thing that we are going to see under this category 1 section is the evaluation and management service. Next comes this anesthesia section, and then comes surgery, followed by radiology, pathology, and medicine. So when we are going to see this evaluation management service, you should understand commonly patients present to the doctor's office with ailments or for any health related problems. So at that time the physician does the physical examination, and prior to this he elicits the history of this patient with reference to his past history, personal history, family history, and its social history, right? So all his occupation, his age, social status, all these come under the social history. Now he examines a patient either as body systems or as body areas, and then he arrives at this medical decision making. So this, we usually call this as an outpatient service or an office visit service. In fact, consultation services are also categorized under this E&M section codes. So here, this EM codes actually begin with the numbers 99. You can easily figure out that. So here again, we have this broad classification as new patients and follow patients. Okay. So what happens here is the new patients actually have a different set of codes, and then the established patients, meaning these follow patients, have a different set of codes. But for consultation services, we don't have this classification as new and established. So we just have only one set of codes. What we would do is after the EM section comes this anesthesia section, where the codes actually begin with this 0. Here you should understand these codes are called as the ASA codes, or the American Society of Anesthesiology. So these codes are considered as ASA codes, and they are unique, where you'll have to report only for anesthesiology services. And here with these codes we can report only certain restricted codes like CVP or modifying circumstances, where the age of the patient will be less than 1 year, or it is more than 70 years, and where they're inducing hypertension. So at such times you will have to use those modifying circumstances. So what you need to understand is you are supposed to report these codes only for the anesthesiologist and the anesthesia providers. Next comes a surgical section. So this ranges from 1 to 6 series, and the 1 series actually is for this integumentary system and human breast. So what happens here is all the dermatologic procedures plastic surgeries and these wound care management services, especially the surgical wound care debridement and procedures on all this human breast, whether it is a biopsy or it is a mastectomy or a lumpectomy, or is it a placement of this breast implant, all these would come under this 1 series codes. Next is just the 2 series codes. These signify the musculoskeletal system. So all the procedures that are being done on the muscles and the skeleton, whether it is the bone or the joint or the synovium or the tendon or the tenosynovium or the ligament or the cartilage or the aponeurosis or the fascia, all of this would come under this particular system, which is a musculoskeletal system. So you can see those arthroscopic procedures and its open procedures, and of course the percutaneous procedures like fracture reduction, whether it is a closed reduction or it is an open reduction, and spinal procedures. All of these come under the 2 series codes. Next, what we have is like we are moving on to the 3rd series. Now here I'll give you a clue, because when I say like 3, this includes 3 things. So first it is the RS, the CVS, and the hemic and lymphatic. So when I mean by RS, it is a respiratory system, and CVS point to this cardiovascular system, and then it is a hemic and the lymphatic system. So in this respiratory system, we are going to see the procedures that are being done on the respiratory structures like this nose, the paranasal sinuses, the larynx, trachea, bronchi, and the lungs. Okay, so whatever procedure, take for instance whether it is a lobectomy or it is a bronchoscopy, whether it is being done as a thoracoscopic surgery or as an open surgery, all come under this respiratory system. And then we have this cardiovascular system, where it includes all the procedures on the heart and the blood vessels, like the arteries, the veins, and the capillaries. So here the CVS section is a pretty larger section, and you should also understand we also have this cardiology services categorized under this medicine section of the CPT manual too. So the surgical procedures can be found in this 3 series, and then all those medical surgical techniques will be found under this. The cardiology services you can also find in the 3 series as well as the 9 series. In the 3 series you will find the surgical procedures, whereas in the 9 series you have this non-surgical or this non-invasive procedures, okay, like mapping, ablation. So we also have codes for like TEE, monitoring, and all that under this 9 series. So, and the last portion of this 3 series would be this hemic and the lymphatic system, like bone marrow aspiration. So things like, whether harvesting of this autologous bone marrow cells, whether it is like lymphatic cells, all these are found under this hemic and the lymphatic system. Next, we are moving on to the 4th series, which is actually a GI system or the alimentary or the digestive system. All the procedures that start from this oral cavity, till this anal canal, whether it is in the esophagus or in the oral cavity or in the large intestine or the small intestine or in the accessory GI system, which is a hepatobiliary system, all procedures, are included in these 4 series. Okay, even procedures like hernia repairs and peritoneal procedures are also included in this 4 series. Next comes a 5 series, which is actually going to talk about this urogenital. So all these urinary system procedures, like whether there is a lithotripsy, the patient has calculus and the doctor is going to crush it, or the doctor is going to take a biopsy of this kidneys, or there is a tumor and doctor is going to remove those tumor in the bladder via these transurethral surgeries. So all these come under this urinary system. And then we are going to see this male and female reproductive system procedures. So take for instance in males, again there's destruction of lesions, and again when a patient is going to have like erectile dysfunction, so they can come for a placement of prosthetic devices. And they can also come for a plethysmographic study for all these erectile disorders. And if there is any problem with the testes, say in cases of like hidden testes, like cryptorchidism, the surgical procedures. So all these you see under this 5 series. We have this female reproductive system, which again qualifies as a reproductive system procedures for the females. So here we have this hysterectomy procedures, cervical biopsies, vaginal procedures, and then all the sterilization procedures, and again childbirth, like whether it is a vaginal delivery or a cesarean delivery, all these come under the 5 series codes. Next, we are moving on to the 6 series. The 6 series, it deals with this endocrinal system. So procedures on thyroid, like thyroidectomy or parathyroidectomy, or it is like adrenalectomy. So all those endocrine organs are dealt with, and then we have this nervous system. Then we are gonna have the procedures that are being done on this nervous system. Say like neuroplasty or any neurosurgery, a craniotomy procedure or a craniectomy procedure, or the CSF shunting procedure. For conditions like hydrocephalus or like epilepsy monitoring, all such procedures are categorized under this nervous system. And then we have like procedures like this injection services, because we are going to inject, whether it is a neurolysis or it is a neurolytic block or it is for preventing these pain channels. So all that we are going to see under this nervous system. Next, we are moving on to this auditory system and this ocular system. Here, ocular system actually follows the nervous system. So procedures on the eye like cataract surgeries or strabismus surgeries or like removal of chalazion, all those procedures we can see under this 6 series of the ocular system. A patient is suffering from glaucoma, so they do this aqueous shunt surgery. All these are seen under this 6 series. Next, we have this auditory system. Like patient is presenting for this removal of the cerumen, impacted cerumen, and then there is biopsy of ear, or there is a creation of this tympanostomy, which is a ventilating tube, and this they do it for whenever there is a case of otitis media with effusion, and there is a tympanic perforation, so for which they do this tympanic repair by way of tympanoplasty. And again, with reference to those, malleus incus the ossicular chain, they could be like reconstructive procedures. And finally, we are moving on to this next series, which is the 7th series, which is a radiological section where we will be seeing all these imaging modalities like X-rays, CT scan, MRI, ultrasound. So depending on the number of views, you will have to select the codes. And then we are moving on to the next, which is the 8th series. That's the pathological and the laboratory services. All lab tests, like whether like immunofluorescence or this blood test or this enzyme studies or panels like comprehensive panels or thyroid panels. So all that we will see under this pathological section, and all these services will start with 8 series. So here you have the cytological studies and the surgical pathology services and molecular pathology as well. And finally, the last section that we are going to see under this category 1, it is a medicine section, which is a miscellaneous section which contains all these medical services and non-surgical services. So wherever you can't classify under this E&M section and the surgical section, you can find it within this medicine section. So you have this audiometry, audiological test, ophthalmological test, and then we have this gastrointestinal test, cardiological test, nervous system test. So all those medical tests and miscellaneous things like psychiatric services, vaccination, immunization services, these are all seen under this medicine section. So with this, I want to conclude, and this is just a gist of all the services that have been commonly performed, and these are classified under the CPT manual. So this session will be definitely helpful so that you can have a quick recap of all of these, so that when you appear for any of these examinations, it certainly boosts your confidence. Okay, so with this, I'm signing off, and I'll see you in our next video. Take care.
You can contact us at 805 60 855 96 9962 79 1072.